Hello everyone, this is my video on differential tendon gliding exercise. Do you know about tendon gliding exercise and how to administer? We will explore more in this video. Firstly, we will see the description of differential tendon gliding exercise. The differential tendon gliding exercise derived from study using cadaver and in vivo ultrasound done by Marwan A.Y.P. and James M. Hunter in 1985. It is discovered during the first concept by the author that 3 positions were incorporated into an exercise program which consists of straight fist, and hook position. The 3 of the positions described here can provide maximum differential gliding for flexor tendons. Conditions that commonly treated using tendon gliding exercise consist of tendon injury, carpal tunnel syndrome, and hand fractures. Tendon injury is a condition which related to the flexor and extensor tendon that injured, caused by trauma, laceration or repetitive use that cause restriction of movement or abnormalities. It is commonly treated using tendon repair before the post-surgery management for immobilization and motion which include tendon gliding exercise. Next is the carpal tunnel syndrome, which commonly related to tendon gliding exercise for non-operative management or post-surgery management that caused pain, numbness, tingling due to compression of median nerve that result in weakness of hand. Some studies has discovered that the hand fracture, for example, related to metacarpal or phalangeal fracture that will cause restriction due to the risk of developing scar and adhesion after the surgery can be prevented by the management of post-surgery using tendon gliding exercise. It is important to take into consideration of the precautions, especially in early stage of recovery. There has been some protocol and management developed for post-surgery that should be followed in avoidance of rupture of tendon or other injury developing after the surgery. Now, we'll move on to the purpose of differential tendon gliding exercise. Based on studies done for differential tendon gliding exercise, concluded that the purpose of the intervention is to improve symptoms of CTS by preventing or stretching the adhesions among the tendons, to reduce tenosynovial edema, to reduce pressure in the carpal tunnel, to increase circulation to the hand and wrist, which helps to reduce swelling, and to allow the flexor tendons to glide to the maximum potential. Now, we move to the procedure of intervention. Firstly, it consists of 9 steps of differential tendon gliding movement, consists of hand straight, hook fist, full fist, straight fist, and tabletop movement. Before the procedure take place, provide comfortable area with chair and table for patient to undergo the procedure and ensure patient sit in comfortable chair and use the table to place their hand during the procedure. The next procedure of intervention is the exercise regime, which may vary according to the condition. Commonly applied for CTS and trigger finger consists of regime of sustaining each position for 5 seconds with 5 to 10 times repetition of cycles for 3 to 5 times daily. The flexor and extensor tendon injury may have different regime according to the zone of injury and the recovery of patient based on the protocol and post-surgery management. The cycle of exercise may take place according to the phase of recovery of patient, according to days and weeks. So these are the example of procedure of intervention. The first steps of the exercise is the straight finger, which is this position of finger straight will always start in between each step. Patient need to hold the hands in front of them and keep the hand parallel to body while doing the glides. The step will be repeated in step 3, 5, 7 and 9. The step 2 of the exercise is the hook fist, which patient need to curl their fingers down into palm. Patient can allow the thumb to move in a position that is comfortable. Step 4 is the position of full fist, which patient need to make complete fist with their hand, allowing the thumb to curl over the fingers. Step 6 is the tabletop position that patient need to bend their hand at the third knuckle down toward their wrist. The hand should be like L in upside down position and keep the thumb pointing up on the outside of the hand. Step 8 is the straight fist position that need patient to bend their hand down so the fingers make an upside down U. If possible, patient need to touch the base of the hand with the fingertips. Patient can allow thumb to move as needed. There is no specific grading stated in the studies done on the tendon gliding exercise. There will be some discomfort in the beginning of doing the exercise, thus the exercise can be graded by increasing the frequency of performing the exercise. Patient can start with lower frequency of cycle with lower intensity by reducing repetition of glides. These are the evidence base for the differential tendon gliding exercise application on different conditions. The conclusion of this video, there is still lack of evidence for this therapy with combination of other methods such as using splint, ultrasound therapy and tendon and nerve gliding exercise for carpal tunnel syndrome. Some study mention that splint immobilization is more effective in relieving symptoms and improving function in CTS. Yet, there are still some studies that shows improvement in hand function with application of tendon gliding exercise. There are some other studies related to tendon injury mention that incorporation of different treatment method with the differential tendon gliding exercise may increase the recovery process and prevention of developing other deformities after the repair.